Happy day. This is Ghayathri Swetha, Assistant Professor and Head Department of Social Sciences Psychology Program. So I have been delivering this program for second BSc Psychology on psychological assessment. This is a practicum paper. So before we go into the practicum, a brief introduction on why do we study psychological assessment, a prelude to the course. So what is psychological assessment? Psychological assessment is exploring and unraveling the mind. So psychological assessment are a systemic and scientific process of collecting, analyzing and interpreting information about individuals, emotions, behavior and cognition. When we talk about emotions, we study the affective behavior. When we talk about their thought process, it's the cognitive factors. When we talk about study their behaviors, it's their cognitive factors. So why do we actually do psychological assessments? So there's a great significance and importance to study human behavior. It can help in understand the personality development of human beings. It can help in preparing them with effective communication. It can help them in training life skills, maintain healthy relationships and maintain interpersonal dynamics. And it also helps us to understand mental health and well-being. And psychological assessments are widely used to measure educational achievement and success. In organizational settings, the significance lies on to studying workplace productivity, and in mental health, preventive and interventional measures can be of great use by doing psychological assessments. And finally, at government level, local, national and international, it helps in better decision making and policy development. Example, behavioral economics will use largely psychological assessments to study decision science. So what are some applications and scope of psychological assessments? So this is not an exhaustive list, however the most widely used applications. So let's take one after the other. The first one is clinical assessment. So what do we do in clinical assessments? Most clinical psychologists and psychiatrists widely use for clinical assessments for diagnosis and treatment planning of mental health disorders. So what do we do for the normal people who may be at risk of developing disorders, or it could be a normal population such as in an organizational settings, educational settings. We can do psychological assessment to evaluate their emotional well-being and also understand their psychological distress. Thereby it can help in developing preventive measures. In educational settings, what are the assessments conducted? Evaluation of cognitive abilities, aptitude tests, learning styles, achievement tests, a few that is largely used in educational settings. Not just that, it also helps in identification of children with special needs or children in mainstream education or in special education to cater to their requirements. Educational assessments are largely used. In workplace, what are some assessments conducted? So in recruitment process, training, talent acquisition and development process, a wide range of research is conducted to understand the personality traits, aptitudes, vocational interest of their employees and management levels. At management levels, some psychological assessments that are conducted are leadership tests, understand the team dynamics, communication patterns and understand whether they are organizationally fit to show their organizational competencies. And moving forward, neuropsychology is one of the emerging field. Some psychological assessment with specialized training is also required to conduct neuropsychological assessments. So what do they do in such assessments? Evaluation of cognitive functions related to brain health and neurological disorders and diseases are widely studied in neurological assessment. Some tests that's mentioned over here are memory test, attention test and other executive functions are largely studied by neuropsychologists. Few other applications of psychological assessment. Forensic assessment is again an emerging field in the field of forensic psychology. So it largely helps to understand individuals involved in legal processes. Some assessments that are done is criminal profiling, risk and competency, etc. And in developmental psychology, assessments can be conducted right from toddlerhood to senescence. So some child and adolescent assessments that mentioned over here studies identification of developmental delays, early intervention and behavioral issues. So some assessments that can be conducted to understand these objectives are their capacity in academic success, social well-being, emotional functioning among children and adolescents. Again, yet another field in psychology is medical psychology. Health psychologists largely use psychological assessments in their field as well. So some assessments that's done is to study the physical health. Example, to study the lifestyle factors, the risk factors such as smoking behavior, drinking behavior, addiction and so on. And finally, research and psychological testing is not the final but most widely used psychological assessment area. So here psychometricians largely involve themselves in development and validation of psychological assessment. Identification of reliability, validity, standardization of tools is largely done. And they also do advancing studies to understand the cultural differences and developing cultural specific norms in more standardized tests. Moving forward, what are some methodologies and tools that is used to conduct these psychological assessments and testing? So some standardized tests are those that have a very good reliability, validity and framed on a very well-defined operational definitions and objectives are called as standardized tests. To mention few example, IQ test is a standardized test, MMPI and Myers-Briggs test is a personality test that's largely used. And other methods of psychological assessments involve observational techniques. What is observational techniques? Systematic observation of an individual's behavior in their own natural setting or in controlled environment, which could be a laboratory. So some examples are structured observation, behavioral rating scales. And interview is again another type of psychological assessment. This could be both structured and semi-structured. And there is a schedule that's framed what sort of questions will be asked. This is largely conducted as focus group discussion, clinical interviews or structured diagnostic interviews, largely used in clinical interventions. And then self-report measures is yet another method or a psychological tool for conducting assessments. So these are instruments which provide individual with a brief instructions and they can take a self-reporting measures. The forms that's available are, it could be available as a questionnaire or a surveys which can have a dichotomous or a Likert scale. You have different scaling techniques to understand the behaviors. And then projective techniques, which is again used largely in clinical setting where your client is not opening up. In such cases, to study the unconscious and subconscious mind, projective techniques are largely used. An example is they present an ambiguous stimuli to elicit response. And these responses are recorded and the underlying thoughts and emotions behind these responses are deeply studied. Some examples of projective techniques involve sentence completion test, Rorschach-Inkblot, thematic perception test. Few other methodologies involve neuropsychological test. As we have already seen, neuropsychological tests require some sort of an specialized training. Only supervised neuropsychologists do use this. They study the cognitive functions involved with brain and they also identify the deficits related to brain dysfunctions. Some examples of neuropsychological tests involve Wisconsin card sorting test. And behavioral assessments are largely used by behavioral psychologists. They use systematic analysis to study individuals' behavior specific to a situation. They use schedules of reinforcement and punishment to understand the behaviors. So again, this requires training in behavioral analysis techniques. With emerging technology and advancement in AI and digital world, psychological assessments are also conducted as computerized assessments. So computerized assessments help in data collection, scoring and also they generate a very good psychological report. So the forms that's used are computerized cognitive test, online surveys to mention few. And personality inventories are again some methods of understanding the personality of an individual, what are their situational and biological traits. They assess the individual's enduring characteristics of reactivity and patterns of behavior. So case history and record review is again another methodology of studying psychological assessment. They examine individuals' background, medical history and relevant records to provide context of assessment, largely used in clinical setting or the first client meeting. So how do they conduct this? They review medical records, educational history, past assessments and referrals. Okay, now that we understand what is psychological assessment, what is the significance of psychological assessment, what are the applications of psychological assessments and where we use them, it is also essential that as psychologists we should know what are the ethical considerations behind conducting and psychological assessments. Here are few as listed by American Psychological Association Code of Conduct for Psychological counselors and clinicians. So let me go one after the other. The first one is informed consent. Informed consent is while you're conducting a psychological assessment, the subject or your client have to be informed that they are undergoing a psychological assessment, and you should take their permission, their consent before conducting the assessment. So every questionnaire or a survey or any clinical assessments or an interview that you do, it is essential that you adhere to this principle. Confidentiality is again the most important ethical consideration. Since it deals with more sensitive information about an individual's cognitive behavior and emotional aspect, it is very essential that you maintain anonymity and confidentiality of your client. If at all it is done for a legal purpose or for an organizational purpose, it is very essential to disclose the information to your subject and take their consent that this information will be shared for purpose of recruitment or educational purpose and so on. And cultural sensitivity is again a very has to be considered of paramount importance, because all psychological assessment may not be a good fit to any individuals. All individuals share psychology as such is a study of individual differences. So each individual varies significantly in the way they behave, they think and their emotions. So all standardized tests or any forms of psychological assessments have to undergo this key concept of understanding cultural sensitivity. There should be no discrimination in terms of cultural barriers, social barriers, racial barriers. Characteristics of a good psychological assessment will predominantly focus on the cultural context. And then competency, like we discussed, there is quite a lot of applications in psychological assessment. Not anyone who is qualified with master's degree or a doctoral can conduct all types of psychological assessments. Some psychological assessments require periodic training and supervision. So it is essential for psychologists to be aware that they have the required knowledge and competency skill sets to conduct the psychological assessments. What is privacy? As psychologists, we might have a private practice, or we might be a consultant with any other organization. It is very essential that we protect this data. So an organization or the individual should adhere to the policy of data protection of all these documents, psychological assessments. And then beneficence and non-maleficence is again a very important ethical consideration while you're conducting psychological assessment. As we strive to maximize the benefits and minimize the harm to individual undergoing assessments, it is very important that we be very aware and vigilant about the trivial things such as do any harm to your subjects, etc. Okay, and finally, who can conduct psychological assessments? So what are the qualifications and eligibility to conduct a psychological assessment? So when we talk about the education, a psychologist who has qualified master's degree, and some countries may require doctoral programs for completion to conduct a psychological assessment, is very essential. And then training, substantial training in assessment techniques, methodologies, who has a good knowledge about the ethical considerations for conducting psychological assessment is very important. They have to undergo periodic training to conduct the psychological assessment. And licensure and certification is again a very important aspect to understand the qualification of psychologists who can conduct psychological assessment. Some jurisdictions require individuals to write exam, undergo a number of clinical hard training, supervised internships, and thereafter produce a licensure and certification for conducting. But here I just want to keep you informed. In India, except for clinical psychology, rehabilitation psychology and special educators, there is not much of a governing body to understand who can conduct a psychological assessment. So it is very imperative that a good licensure and certification body is essential to understand whether an authorized person is issuing psychological report. Some tests like neuropsychological assessments and forensic psychological assessments require specialized training. So a psychologist who is interested in venturing into these assessments should essentially take some training and certifications before they get into the field. And continuing education is again is very important to improve the credentials of a psychological assessor. They have to attend and stay in line with the current trends. They should attend workshops, conferences and trainings of new, psychological assessments. Thereby they understand what is the relevance, and there is advancement and updation. 20 years back there could have been a paper pencil test, but with advancing a similar psychological assessment could have now been computerized. So it is very essential that you continue your education as psychologist to have updated knowledge and become more marketable in the field of psychology. And finally, adherence to all these ethical guidelines is very essential. And in some sectors, especially when it comes to clinical psychology and neuropsychology and forensic psychology, it is very essential that a supervision is very necessary in the initial practice of psychologist. So supervisors can help you in getting training, helping you write cordial psychological reports, and also help you manage your clinical assessment work. And after a number of supervised clinical hours, you might draw the expertise to conduct psychological assessments. And finally, to close, context specific requirements I may not have listed all the ethical considerations or all the applications, but as the context demands, it is very essential that you be aware about what is necessary to conduct a psychological assessment relevant to the context. Example, if it is a school setting, a school psychologist have to be trained enough to understand what are the developmental delays. A wide knowledge on the development aspects, child and adolescent health is very necessary before they conduct the assessment and report the findings. I hope this session had been very interesting, and this can help you find more ways to develop qualifications and understand the ethical considerations and become a psychometrician or a good psychological assessor. Thank you.